Hello guys. How are you guys? Hope you are well. Today we have come with news video. You can be with us in this video and find out your health information by watching the title. You will understand what we know today. Before you start the video, subscribe to this channel and be sure to press the bell icon and don't forget to like this video. Introduction. You will also find out which exercises will work best when you have COVID and whether any exercise in COVID helps. Is it good to work out when you have COVID? COVID is a serious lung disorder that can affect your breathing and cause coughing and wheezing. It can also make it harder to exercise. But working out can help improve your lung health and reduce your symptoms. So if you have COVID, you should still be able to work out. COVID is a serious lung disease caused by breathing in too much smoke and ash while working or playing outdoors. Symptoms of COVID can include coughing, shortness of breath, and fatigue. COVID is an illness, not a condition, and can be fatal if not treated. COVID can be avoided by not breathing in smoke and ash, but that isn't always possible. COVID is a serious lung disease that can cause coughing, difficulty breathing, and chest pain. If you have COVID, you should not exercise heavily. However, if you're looking to build muscle, lose weight, or just stay active, you can still work out safely and build a resistance workout. We'll discuss how to build a resistance workout that is safe for you to do with COVID, and provide a sample workout plan for you to follow. COVID is a common blood disorder that causes your red blood cells to become abnormally shaped. Red blood cells are important because they carry oxygen to your body's organs and tissues. COVID is often asymptomatic and goes undetected. However, when symptoms do appear, they can include fatigue, shortness of breath, and pain in the arms and legs. Does exercise help COVID-19? COVID-19 is a rare genetic condition that can cause pain, skin problems, and fatigue. The only treatment for COVID-19 is a stem cell transplant. But stem cells can only be harvested from someone who is still healthy. So if you have COVID-19, the only way to keep your stem cells alive is to keep moving and stay active. COVID-19 is a rare genetic disorder that causes developmental problems, including intellectual disability and motor delays, as well as abnormal movements and seizures. New research is exploring whether exercise can help improve some of the symptoms of COVID-19, and the preliminary results are promising. In a small study, 12 children with COVID-19 were assigned to either a control group that did not exercise, or an experimental group that exercised for an hour each day while following a nutrition and supplementation plan designed to support their exercise efforts. The children in the exercise group experienced significant improvement in their motor skills, with the greatest improvement occurring in their motor planning skills. COVID-19 is a rare genetic condition that can cause problems with movement and development. Fortunately, a new drug called COVID-19 uniquely targets and improves the condition in animals with COVID-19. It also appears to improve movement and development in humans with COVID-19. Unfortunately, this drug is not yet available to the general public. Exercise may help people with COVID-19, a rare degenerative brain disease that usually causes no symptoms in the early stages. Results of a small study suggest that regularly exercising may help people with COVID-19 stay healthier longer. However, more research is needed to better understand the benefits of exercise for people with COVID-19. Continued, COVID-19 is a rare lung disease that primarily affects young adults. There is currently no cure for COVID-19, and it typically gets worse over time. Because there is no cure and no way to slow or stop the disease, finding treatments that can help manage the symptoms is important. One such treatment is physical activity. Is walking good for COVID patients? COVID, also known as central postural orthostatic tachycardia syndrome, is a disorder that makes it difficult for sufferers to stay upright. The condition often presents with palpitations, dizziness, and fatigue after exertion, which can make it difficult to do daily tasks. But a growing body of research is showing that physical activity can help mitigate the symptoms of COVID and may even help improve overall quality of life. In this article, we'll discuss what is currently known about the benefits of activity for those living with COVID, as well as tips for those who would like to incorporate more physical activity into their lives. Walking is often recommended as a form of exercise for people living with chronic obstructive pulmonary disease, COPD, but for some, it can be difficult to engage in the activity due to their symptoms. A new study, published in the Journal of Physical Therapy, explored the potential benefits of walking for people living with COPD, specifically those with chronic obstructive pulmonary disease, COPD. The results of the small, controlled study found that while walking did not improve lung function in COPD patients, it was associated with a reduction in fatigue and improved quality of life. The study pointed to the potential of this form of exercise to improve the lives of people living with COPD and stated that further research is needed to investigate the potential benefits. COVID is a rare disease that can cause pain and difficulty walking. New research suggests that walking may help improve symptoms in some people with COVID. But more research is needed to find out how much activity is best for COVID patients and whether certain types of activity may be more helpful than others. Find out more about the benefits of exercise and the best ways to help manage pain and improve movement in people with COVID. COVID, also known as complex regional pain syndrome, is a neurological condition that causes chronic pain and often extreme muscle and joint pain. It's typically characterized by periods of severe, intense pain followed by periods of relative remission. COVID is usually treated with opioid medications, but these medications have a number of side effects. A new study has found that a commonly used form of exercise may help manage some of the symptoms of COVID, including the sometimes debilitating muscle and joint pain. COVID patients, also known as cerumino-occlusive disease, blockage of the earwax glands, experience symptoms such as earache and hearing loss. COVID is a condition that can't be cured, but it can be managed. One thing that helps manage COVID is regular exercise. Not only does exercise help improve your energy levels and mood, it also helps your COVID and helps reduce symptoms such as earache and hearing loss. Can I exercise outside if I have COVID? It's a question that's on the minds of most people who have been diagnosed with chronic obstructive pulmonary disease, COPD. Can I still exercise outside? The answer is a resounding yes. While it may be a little more difficult for some people, the vast majority of people with COPD can continue to exercise outside, even if it means making some modifications to their current exercise routine. For those who are ready to take the next steps in the right direction, there are a variety of COPD exercises that can help improve breathing and lower the risk of flare-ups. COVID is a condition that makes it hard to sweat. For many people, exercising in the heat is the best way to sweat and cool down. However, for people with COVID, exercising in the heat can be dangerous. If you have COVID, you should avoid exercising in the heat. It's a beautiful day, you have the perfect opportunity to get some exercise in the fresh air. But you're feeling a little under the weather and don't want to risk getting worse. You're also feeling a bit tired and aren't sure whether you should exercise or not. You're worried it might make you feel worse, but the idea of missing out on the fresh air in the exercise is making you feel even worse. COVID is a condition that causes a person to feel tired and dizzy when they exercise. It is caused by low levels of oxygen in the blood, and the best way to treat it is to increase the amount of oxygen in the blood, which can be achieved through exercise. The best form of exercise for COVID is aerobic exercise. It increases the amount of oxygen in the blood, and has other health benefits such as reducing stress and preventing disease. It's a beautiful day outside, and you've decided to go for a run to clear your head and feel the sun on your skin. But then you remember, you're supposed to keep COVID indoors today. What now? Don't let a little sickness keep you from staying healthy. Conclusion: so you know that exercise in coronavirus helps us and you guys understand very well.